Okay, so this is our lab preview for the forearm and hand dissection. This should be kind of where you're at with the arm. Hopefully they were able to remove skin down to the elbow last time. And we're actually going to start by backing up a bit because I think most folks didn't get the arm muscles all figured out in the last dissection. So I think that's probably where you might want to start. This is quick work, just going through biceps, long head and short head, or long head and short head rather. Biceps, or the brachialis, should be just deep to it. You should be able to find coracobrachialis right up at the top. And you can probably roll the arm over enough to see triceps brachii, probably lateral and long heads, without actually turning the cadaver over. If you're interested, you should also cut the triceps lateral head along this line and open it up, and then that's going to let you see the medial head of the tricep, which is down underneath. So have a look if you're interested in the heads of the triceps, but don't feel like you need to turn the cadaver over for that work. That should be just fine. Then we're going to have you go ahead and remove skin. I would suggest removing skin from the forearm first. It's a pretty easy step. Removing skin from the hand's a little trickier. So go ahead and just take the skin off of the forearm down to the wrist in the first stage. I know this is a little different than your instructions say, but for now, just go with it. And then that's going to expose the muscles of the anterior forearm as well as posterior. They're going to be wrapped in a dense fascia, and you can go ahead and remove that. Likewise, any superficial fat or veins that you might find in the superficial fat, take them off. Likewise, superficial nerves, take them off. You can leave nice long pieces if they're like the medial cutaneous of the arm and forearm that you found connecting from the brachial plexus. You can keep some of it, but the fact is they're skin nerves, so they're going to have to be cut. But let's take a look at the anterior forearm first. That's where most people will probably want to start. I would first identify the brachioradialis. Technically, it's in the posterior forearm. It's part of that compartment, but it does cross anterior to the joint, so you'll see it if you're looking at the anterior forearm, and it's good to get that one out of the way right away so you don't confuse it with some of these others. The rest of them, you should start with the medial epicondyle and find the different muscles that come from there, like pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. You ought to be able to find those pretty quickly once the fascia has been removed from its surface. Once you're in this space, you'll be able to find the big nerves, arteries passing through the forearm. This shouldn't be a terribly taxing task. Hopefully you were able to find the median and the brachial artery, or in the sort of groove in this space. The brachial artery will be running through here with the median and the ulnar nerves, and then when the nerves get to the elbow joint, the median goes anterior and the ulnar goes posterior to the medial epicondyle. So you should probably be able to demonstrate that all right. And then if you take this brachioradialis and you move it, this is where it used to be. If you push it out a little bit laterally, you ought to be able to find the radial artery lying in that space. And then down here would be where you'd feel it when you do a radial pulse. Likewise, if you take the flexor carpi ulnaris and you pull that medially, you'll be able to find the ulnar nerve and the ulnar artery lying just deep to it. Okay, so those are some pretty reliable standard relationships. The next thing you might be looking for is median nerve. Remember, this came down through the arm and crossed anterior to the joint with the elbow, but then it dives deep to these muscles and you can't really see it very well. So if you want to see median nerve, you're going to have to get some of these muscles out of the way. So typically median nerve is found right deep to the flexor digitorum superficialis, which is underneath this first row of muscles that we identified. So after you identify this row, you'll want to identify the FDS, and then you'll want to be able to move that out of the way in order to see the median nerve. Now you won't have to move any of these muscles that far out of the way. These move quite a bit, so you can get down to these deeper layers without cutting anything at this stage. Also at this level of depth, you should be able to see flexor digitorum profundus and the flexor pollicis longus. Down a little bit lower, you might be able to see pronator quadratus, depending on whether or not you got that skin all the way down to the wrist. Okay. All right, so that takes care of the anterior forearm. It's mostly muscle work with a couple of big nerves and arteries that are continuous from the arm. So I don't think the neurovascular part's going to give you a whole lot of trouble. Flipping over to the posterior, again, start with the brachioradialis because that's the wild card that'll kind of throw you. And make sure to differentiate the brachioradialis from the two muscles that are right nearby it, the extensor carpi radialis longus and brevis. They are all right up stacked next to each other, and it's important to see that the brachioradialis comes from a slightly higher spot. It is attached above the lateral epicondyle, whereas the extensor carpi radialis muscle is attached at the lateral epicondyle. Then you should be able to march through the rest of the muscles of the posterior forearm pretty easily. Extensor digitorum, digiti minimi, extensor carpi ulnaris. This forms the superficial row. And then I would recommend go ahead and remove skin from the dorsum of the hand. That's a necessary step because these muscles are way, way easier to identify if you can just follow the tendons all the way to the fingers that they supply. We don't need to remove any skin from the fingers, just the dorsum of the hand will do. And I would also recommend removing the retinaculum and so that you can follow tendons through. The extensor retinaculum has lots of attachments to the carpal bones along the way here, and so there's lots of little tunnels that you'll have to open each one individually. But you can thank me later because after you get these things released, it's so easy to follow these tendons to their destinations. Just like in the anterior forearm, there is a deep layer underneath the superficial row, so you might want to separate them, move them apart. Obviously not this much, but that'll allow you to see things like the extensor indices, which is going to the first finger, the extensor pollicis longus and brevis, longus here, brevis here. You can see they have different origins, one on the ulna, one on the radius, and these are going to the thumb. And then the abductor pollicis longus, and even the supinator you should be able to see in this space. If you remember from lecture, the snuff box is also found in this area. It's where the extensor tendons cross over here, and you might be able to see where the radial artery comes through that space. So then we should probably turn to the anterior and remove skin from the dorsum of the hand, or from the palm of the hand. And that, again, just the palm. We don't need to remove any skin from the fingers. The directions indicate removing one finger, but I have a feeling we might be short on time today, so let's let that go unless we have extra time at the end. So the skin removal on the palm is rather difficult because most hands are kind of contracted, so this is going to be difficult work, and I want to just remind you to be careful with your blades because it's really easy to cut yourself when you're trying to hold that hand open. And again, you know, we've talked about sort of sensitivity in the lab, and doing the hand dissection is one of those things that sometimes is sensitive for people, so please observe that and be kind to one another today. But once you get the skin off of the palm region, the first things that you'll recognize are the thenar muscles, the hypothenar muscles, and the palmar aponeurosis or palmar fascia. And I would suggest starting with the thenar muscles and hypothenar muscles because they're kind of easy to identify quick, and it makes it feel good after getting that tough skin off to get some instant gratification. And you can identify all three real quick. In both cases, the abductor is the muscle that's on the outside. The flexor is the muscle that's on the inside. So again, abductor is on the outside, flexor is on the inside, and if you pull them away, you don't have to pull them this far, we can just sort of do cut reflect, you'll find the opponents deep to both. So if I pull the abductor and flexor away here, I get the opponent's digiti minimi. So that's kind of nice. They're mirror images of each other. Then the next step would be to get this palmar aponeurosis reflected. And that is a tricky business sometimes, but do hard work and get it off, and hopefully what you'll preserve right underneath that is the superficial palmar arterial arch. So you'll probably want to reflect this with scissors rather than a blade, because you might cut that arterial arch off completely inadvertently. But this is the arterial arch that is primarily fed by the ulnar artery. And while you're in this area, you might find the median nerve coming into the hand. It would have been going through the carpal tunnel, which is not this small. It's much thicker and nastier, and probably about an inch from top to bottom. So if you want to, you can certainly cut that carpal tunnel open and release the contents that are inside of it. It's easy to follow everything through once that's cut. And then you might want to follow the median nerve out to some of its branches and find some of the digital branching. And you'll see that there's a common digital branch for these two fingers, and then when it gets right about to the webbing between the fingers, it'll split into two proper digitals to serve the adjacent faces of these two fingers. Likewise, the arteries do the same thing. There's common digitals that then split to proper digitals, which run up the sides of the two adjacent fingers. So that's this lab in a nutshell. It's a lot of muscles, but thankfully they're names you've seen before, and I hope that it goes well for you.